Hi, I'm David Martin Davies with Texas Public Radio's The Source. Today, we're continuing our vital conversation about how we can rebuild for resiliency in this time of COVID-19. Now, we're taking a deeper dive into the nuts and bolts approach of rebuilding after coronavirus in a way that addresses racial and economic disparities. Our event today is part of a series of vital conversations made possible by the John L. Santikos Charitable Foundation, a fund of the San Antonio Area Foundation. And our panelists today include Marjie French, the CEO of the San Antonio Area Foundation. Marjie, welcome. It's great to have you here. Also with us Tuesday night, CEO of the San Antonio Growth on the Eastside, Sage. Tuesday night, good to have you.
Thank you for having me.
Janie Barrera joins us, the president and CEO of LiftFund. Janie Barrera, it's great to have you on here.
Thanks, David.
And also Scott Ackerson, executive vice president of the Strategic Relationships and Services for Prospera Housing Community Services. Scott, it's great to have you.
Thanks for having me, David.
So we're going to have a conversation talking about how COVID-19 and the illness itself, how that's impacted our community, but also the economic fallout and how that's hurting individuals, small businesses, nonprofits. What can we do working together as a community, sharing resources, insight, helping people fill the gaps in order to prepare San Antonio to continue to get through the pandemic and on the other side, come back stronger. That means looking at how can we stop the hemorrhaging, how do we stop losses, are there areas where we can spend dollars now wisely that will keep people afloat so that we don't have this loss of resources and investment. Investment for some people, it's a lifetime of work that could be wiped out if we don't do a little bit of effort right now and spend that money wisely. So how can we do that? So we welcome questions from people who are monitoring us online, who want to join in and tell us what you're seeing and what you want to see happen. But first off, let's kind of go around through our panel, and if we can hear about what you're seeing and what you want to see happening right now. And let's start off by hearing from Marjie French, the CEO of the San Antonio Area Foundation.
Thank you, David. We're just so happy to collaborate with Texas Public Radio on this session. We believe it's so important as we think about recovery to have people come together and have intentional conversations on how we can build back better. We at the foundation for a long time have been looking at how to build up our community and build it in a way where who you are or where you come from doesn't determine your life success. So for us, these types of conversations, we're listening, we're learning, and boy, these folks that we have today are doing the good work. In terms of affordable housing, Scott, what you're doing with what Prospera is doing with affordable housing with those wraparound services, we are so happy to invest in that. Tuesdae, the small economic development businesses on the east side, we are with you there and want to keep funding you. And Janie, oh my gosh, the work that we've seen that you've done and continue to do through COVID with LiftFund, and also with your collaboration and partnership with our African Community Fund. So again, I'm just so happy that we're all here, and I look forward to learning more from each of you today.
Tuesday night, what are you seeing as you deal with Sage, with the Eastside and the small businesses there?
Well, thank you, David, for having us. And Marjie, I'm going to echo almost everything that you said. What we're finding on the east side are issues that have been in existence forever. This isn't anything new. The difference is that the spotlight is on it now. And so we're seeing the disparities, we're seeing the inequality. And I think that that's great. I hope the spotlight stays. There are, on the east side specifically is who we represent, but the issues that we're seeing are literally city and nationwide. The small businesses are having issues with sustainability. resiliency funding. There's tons of things that are a part of the issues that we're seeing now, but again, are not only owned by the Eastside. So what we're finding is that the need for businesses to receive support, access to healthcare, access to funding, access to information, those are the biggest things. And if we can tackle those three things, then we have a great start.
Jenny Barrera at LiftFund, what we're seeing now, what's happening to small businesses that if this is unaddressed, we're having an extinction level event for many small businesses, and LiftFund is trying to step in to keep that from happening. Can you talk about what you're seeing?
Thanks, David. Yes, definitely. As you know, 80% of the economy here is small business in San Antonio. And what I have seen is that even small businesses don't understand that they're small businesses. And I'm talking about sole proprietors. Yes, we know that the person that has the barbershop or the beauty salon, they see themselves as small business people. But how about the person that cuts your grass? Or how about the person that is out there painting houses or being subcontracted with 1099s? They don't realize that they are entrepreneurs themselves and that they are eligible for the PPP loans that we have still open until August the 4th. Excuse me, August the 6th is our last day for people to apply for PPP. So if you are, let's just, because it's payroll protection plan, you think that it's payroll, but I have to have employees to have payroll. We need to remind people they are payroll on themselves, for themselves. They are self-employed. So let's bring out the community, and we've been working so closely with Tuesdae and her team over at Sage to spread that word, to give people hope. There's something out there that they can apply for. Yes, it's called a loan, but after 24 weeks, it turns into a grant. And LiftFund and Sage and Westside Development Corporation and others in our community are here to help you maneuver through that system, sole proprietor, 1099 person, so that you can receive these funds. And it's as easy, David, as going to your Schedule C. If you're a sole proprietor and you're getting 1099s, you go to Schedule C, line 31. That says how much income you made in 2019, divided by 12, times 2.5. That's how much money you're going to receive from the PPP process. And it can be as little, we've done loans as $600 that are going to turn into a grant. And we've made loans up to, five digits in terms of 25,000, 30,000, 40,000. But my point is the bigger businesses, they went right after it. It's these small businesses that don't know that they qualify for that we've got to reach. I hope people that are listening today go out, the guy that's helping you or the gal that's helping you this weekend at the house, ask them, do you get a 1099? If so, email LiftFund, email or go to the website liftfund.com or Sage.
And if people who are watching us have actionable questions, how do I get this money? What do I need to do? This is a time to engage. We've got a panel of experts here that can help you along those lines. Let's go to Scott Ackerson at the Prospera Housing Community Services. And the clients that you have at Prospera, these typically are a vulnerable population, hit hard by COVID-19, but they were already hit hard prior to this. Even in the best of times, we have vulnerabilities that need to be addressed. Can you talk about what you're seeing at Prospera?
So first of all, our response to the COVID pandemic, we had to certainly change our service delivery model. So we went to virtual service delivery, but we had to keep in place essential services. We can't let people living in our properties suffer with food insecurity and those types of things. And I really want to send out kudos to the San Antonio Area Foundation and other foundations for really mobilizing quickly. Resources were put out very quickly, distributed very quickly. And with those resources, we've been able, since March 25th, when the pandemic really hit, we've assisted over 1,300 families with eviction prevention, including rental and utility assistance. We've provided food assistance to more than 6,000 people on 45,000 occasions. That's been a major factor in this pandemic, is people have children at home now that normally were being fed at school. So your household income is getting smaller and smaller because you're having to spend more and more. And as part of our virtual service delivery, we implemented what we call wellness checks. So instead of waiting for the residents at our properties to come to us, we've been reaching out to them telephonically and otherwise to get in front of issues they might have. A large number of people living at our properties are in the service industry, so they've seen reduction in hours or complete loss of hours. And so we're reaching out ahead of time to say, have you lost your job? Do you need assistance with X, Y, and Z? So that we've really changed everything. But I also want to say, we had a crisis looming before the pandemic ever hit around lack of affordable housing in San Antonio. I was a consultant nationally and across cities across the United States, working in the space of homelessness, housing, and the intersect with healthcare. And I joined the Mayor's Housing Policy Task Force, which is why I joined Prospera. The writing is on the wall that if we don't really increase our capacity and availability of affordable housing, we're going to start to look like other major urban centers with high numbers of not only homeless, but unsheltered homeless on the streets. And people don't recognize homelessness until people are on the streets. By then it's too late.
And you, Scott, worked with the homeless quite a bit at Haven for Hope, and that was working to get them out of homelessness into places like Prospera and other housing opportunities. But the concern is right now with the loss of the bonus money for unemployment and other available dollars, evictions are going to surge. The concern is that we're going to see a lot more homelessness, and what can we do now to prepare for that?
It's a resource issue, and kudos to the mayor for putting together the task force and really looking at the issues of housing and affordable housing. But with the projections before COVID of doubling our population in the next 20 years, and with already a lack of affordable housing, we were going to see that phenomenon anyway. It's really got speeded up and fast forwarded. So the other thing, there's this misconception that homeless services end homelessness. Homeless services do not end homelessness. Haven, and full disclosure, I worked there for 10 years, so I'm a little biased, but arguably one of the best programs across the United States. But that's for a program when people become homeless. If we're not working on the upstream interventions and really addressing the comprehensive policies of poverty, unemployment, living wage employment, access to quality housing, on the issues of historic oppression and institutionalized racism, if we're not dealing with these upstream interventions, we're going to see more and more homeless. Haven was not designed to end homeless or to prevent homeless. It was designed to help people once they become homeless. We got to get in front of this curve.
And this is a critical time for that, because we don't want people who became transitional homeless because they got forced out, because they lost their job because of COVID, and then they couldn't pay their rent, and so they got pushed out, and now they're living out of their car. And it's not just them, it's a family. This can have a cascade effect. So Marjie French, the CEO of the San Antonio Area Foundation, are y'all sensitive to this? Are you watching this? What do you think?
Yeah, I want to go back to sort of the triage that we did in March when we saw the emergency that we were having with our economy due to the Black Swan event, which of course was COVID. We were able to very quickly raise $6.4 million and to deploy that through just wonderful collaborative grant making to the community. We were able to very, very quickly deploy those funds to over 203 nonprofits that we felt were serving the most vulnerable. What surprised me about that was how quickly the foundations and the United Way, who was a great partner with us, got together and understood the necessity of getting these funds to the nonprofits to help the most vulnerable. What we're seeing right now is, of course, we don't know if we're still in triage or if we are truly at recovery, right? We're looking at recovery for sure, but we think it's going to get worse, unfortunately, before it gets better. So it will take resources. I do think that we're watching those nonprofits that can get assistance into the hands of vulnerable families very, very quickly. We're looking at ways to build up those nonprofits that are helping with workforce. We can't expect people to work if they don't have sustainable housing. If these families aren't feel vulnerable, it's very hard for them to put their kids through school and to work to get that living wage. So we are watching those nonprofits that are the most innovative in delivering these desperately needed resources.
Let me remind people who have tuned in late that this is a vital conversation. I'm David Martin Davies with Texas Public Radio's The Source, and this is a conversation made possible by the John L. Santigos Charitable Foundation, a fund of the San Antonio Area Foundation, and we're looking for ways to build back stronger and bring greater resiliency to the San Antonio area. But back to you, Marjie French, as these nonprofits are being put to the test to try to do all of this extra work and challenges, they're seeing their funding also part of this upheaval being taken away, because you can't have the in-person galas, you can't have the booth at Fiesta or whatever. However you fund your nonprofit, those things are no longer possible. I mean, what's happening there?
Well, I think that many of the nonprofits are pivoting to better innovation, right? So we saw the arts organizations who are struggling, but they are pivoting their programming to educational learning opportunities. That was attractive to us because, of course, we understand that kids at home needed those educational online learning opportunities. What we did in this last round of funding is we helped those institutions with the technology that they needed to get to pivot to be able to deliver those services. You'll see us trying to strengthen nonprofits where they sit and help them deliver those services that they can deliver. I don't know if all of the nonprofits will make it without the gala funding, without the funding from Fiesta. But I know that the key foundations and corporations in our community are extremely generous, and we will be looking at strengthening the capacity of these nonprofits to deliver services.
You know, David, along those lines, I would hope that going forward, families and individuals that were already participating in these galas, already, going to these events, we probably have, I too participate in these fundraising events. I know how much money I would have put into my budget to attend these things. And yes, it's good PR, it's good. That's how we network with one another, by going to these events. Okay, we're not having these events, but they maybe have virtual events, and there's no reason that you can't write that $100 check and send it to that where you are going to buy yourself a couple of tickets to attend a gala. Now let's just send the money directly to the not-for-profit. It'll streamline a lot of things, and that's one of the ways that we can continue to be resilient.
I have a question from our viewer, from Sharon. Do you qualify for a PPP loan grant if you receive a economic injury disaster loan? And so Janie, Barrera, LiftFund?
Yes, David, thank you. Yes, they do. You can apply for both. If you receive the EIDL, what they call the EIDL loan from the SBA, you are eligible to apply for a PPP loan as well. And by the way, when we talk about not-for-profits can apply for PPP loans as well. So if you're a not-for-profit listening out there and you haven't done so, go to our website, go to Tuesday's website.
Right.
So Tuesday night, CEO of San Antonio Growth on the Eastside, Sage. So your work is deeply connected to small businesses on the Eastside. There are a lot of really fantastic mom and pop eateries on the east side that I think everyone should make a trip to go visit, because you're not going to get anything else like that anywhere else. But do these businesses, are they getting support in learning how to transition to service in with these new reality of COVID?
Well, what Scott said was right on when he said that the economic stability was tenuous before COVID. It really was. And so again, with the spotlight on it, we're seeing what those issues are. And so what we have found specifically on the east side, which is again what I'm speaking to, there's a little over 2,100 businesses. They're mostly mom and pop. They're mostly small businesses. We have a few big. Of course, the one big that we all love are our Spurs that's on the east side, but we have a lot of businesses that are on the east side that are struggling. And there's so many reasons why. As Janie mentioned about the issues of being a sole proprietor, we're finding those. And so what we're trying to do at Sage is trying to find out what those business owners, what their needs are and what the issues are. Now, we know it on a larger scale, but everyone's different. And so we're trying to reach out to those businesses and get the information, because again, as I mentioned, access to information is a difficult thing. We thankfully, in the beginning, as a wonderful partner of the Area Foundation and of LiftFund, and thankfully with our bank, we were lucky in that we received the PPP early, in that because we applied and we had a relationship with our bank. We have great partners. But we found that those small businesses didn't have that same access. They didn't have the relationships. So what we did, again, with what Margie said, we had to pivot. So in knowing that we were successful in receiving the PPP, we decided to help our small businesses in their application process. So we've helped more than 50 people apply for this PPP, and thankfully it's still out there. By finding out what the needs are, we are able to build those partnerships. So again, with the Area Foundation and with LiftFund, we've partnered with the city and the county and their recovery and resiliency programs, Bexar County Strong. Let's look at the numbers. So the numbers initially for the Bexar County Strong program was $6.5 million available. There was $21 million worth of requests. The city program that just ended, there was $24.7 million available. $100 million in requests came through. So it is a thing that is happening to everyone in our nation and in our city, but specifically because San Antonio is functioning on those small businesses and really relying on them, we have to find out a way to help them. So with pivoting, what we've done is trying to figure out a way to be an access and a hub for information, so people can access that information. They can find out where the resources and opportunities are. And again, just partnering with our partners here on this call and finding out what information they have and what we can use to help them. Another thing that Scott mentioned about the housing, the city has an emergency housing assistance program. A lot of people don't even know about that. They can get up to $3,500 worth of support and $1,500 in utility support. A lot of people didn't even know about that. So we're trying to find where we can get the information, how we can share it in the best way possible without doing face-to-face, which is what we relied upon before, and trying to get that information into the hands of the people that need it.
Yeah, information, lack of information, and there's so much available online. But this goes to a question that we got online from Gavin. He says, I would like the panel to touch on the digital divide with so many services, grocery shopping, all retail, education, health services, to name a few, are going virtual online. Having digital access is almost like having running water and electricity, a utility that you have to have. But many people don't have it because it's too expensive. The digital providers still price it as a luxury. What can we do to make digital access more affordable and available? And so I offer that up. Anyone want to answer, like, how do we provide digital access? Scott Ackerson at Prospera Housing Community Services, do y'all have available like Wi-Fi, community Wi-Fi? How do you deal it with your housing?
So some of our complexes have Wi-Fi throughout, but all of our properties have community centers, and that's really the heart of the properties. That's where we deliver the supportive services, and in each of those, we have a computer learning center. So students, adults, and others that needed access pre-COVID, during COVID, or after COVID, that's another essential service that we're providing. And sort of my opinion on that is Wi-Fi really needs to be seen as a household utility and not a luxury. It can't be.
Yeah, when you think about how much commerce is done online, or education opportunities online, not having that, basically you are segregated from an important part of our economy and opportunities for self-improvement, self-education. So, I mean, is this showing up, Marjie French, at the San Antonio Area Foundation as a hot area that needs to be addressed?
Absolutely. I sit on the UP Partnership Board, which is a youth success collaborative. Many of the superintendents sit on that board, and the Area Foundation seeded that continues to support that collective, right? So that's what the educators across the city are seeing. That certainly when kids are at home, you really see the inequities of those families who can afford the technology to be able to allow their kids to learn. And so it certainly is a problem. We see that with nonprofits, not only in the hardware, but just the technical assistance that it takes to really pivot and get these organizations running successfully again. So we're seeing it across the board. It's something that we have funded and we will continue to fund.
And Janie Barrera at LiftFund, this is a problem that we see traces along racial lines. We see that communities that are neighborhoods that are heavily minority populated have a harder time being able to access Wi-Fi. It'd be more expensive in those neighborhoods than it would be in other parts of San Antonio, and that seems like some sort of institutional unfairness there. I mean, anything we got to address the fact that a lot of the problems that we're bringing up do trace along racial lines.
Yes, David. And, it's been an aha moment for many people. Oh, really? They don't have access? Everybody has access. No. Even the Federal Reserve has gotten involved. Jordana Barton has become an expert in that and promoting the use of internet and having technology available in lower income families. So, for example, when we were doing the job, when we were working with SAGE and the other nonprofits around the city, that was one of the findings. Down the south side, they weren't able to have access to the internet for us. So they either had to make arrangements to go to the bibliothèque or to find other ways. Our lenders actually had, their iPads with them and would go in when somebody, obviously 6 feet apart and all that kind of stuff, but help them fill it out so they could hit enter there on their iPad to get it into the system. We are, I'm here at LiftFund office. We are open to the public. Yes, you have to knock on the door. We take your temperature, but we have people walk in with their applications because they have no way to send us the information, if not to literally get in the car, come in the parking lot, open the door, and deliver the material. So it's a real thing. People do have lack of internet.
And yeah, I was going to you next, Tuesday night. Go ahead.
I was going to say, can I jump in? I'm like,
yeah.
100%. I'm just nodding my head at everything that Janie is saying, because as a partner helping with these projects, we were having people even having issues of separating their bank accounts and bank statements because as sole proprietors, they're merging the information. They don't have the financial education. I can't tell you how many people we've met with that have been in business for dozens of years. And this is the first time they've ever had to ask for support, the first time they've ever had to apply for anything. So let's tie in the access to the digital divide, right? So let's talk about that. If they can't even access because they're using a phone, they don't have a laptop, they don't even understand what uploading a document means, they had to physically go in and talk to somebody. So tie in the fear of COVID and the fear of being in a close proximity to somebody with a need to use those people to get funding. So it was really difficult to get people in because the issue is just access. And again, when you look at people and say, well, there's no reason why someone shouldn't have internet. There's people who have 3 and 4 kids, who are sole proprietors, who may have a computer, but they need it for their children to go to school. And so there are several things that came about this digital divide that really just put a spotlight on where the disparities lie. And it's all over the city. Again, the number, I think the last time I just said, I think the last time I heard was 1 in 4 households in San Antonio don't have access to high-speed internet. That's an issue.
And Marjie French, as we look at San Antonio as a city that's got to compete against other cities for great jobs and education, I mean, shouldn't this be a problem that we see as something that San Antonio needs to fix for the future, for a stronger, more resilient future?
Sure, absolutely. I mean, you just have to take care of the basics, right? To get better. Certainly, workforce development is something that I sit on that committee, the mayor's committee on workforce development, and I think I spent most of my career in higher ed. So yes, we're going to have to pivot and get people retrained very, very quickly. We're going to have to put more efforts to get people over into the cybersecurity area for sure, and train people so that they can make a good wage, a good living wage, to be able to help them stay above that poverty line. But they can't do that unless we can provide those basic services, right? It's just a no-brainer, and certainly with this the generosity that's here in we call the spirit of San Antonio, we can do something about that.
So I want to remind people who have tuned in late that this is a vital conversation about how we can rebuild for resiliency. We're taking a dive into the nuts and bolts approach to rebuilding after COVID-19 in a way that addresses racial and economic disparities. And this event today is part of a series of vital conversations made possible by the John L. Santikos Charitable Foundation, a fund of the San Antonio Area Foundation. So let me go over to Scott Ackerson, Executive Vice President of Strategic Relationships and Services for Prospera Housing Community Services. So how have you seen the housing crisis break along racial lines?
So if you look at the demographics of the people living in our properties, 85 to 90% are people of color. That tells you something right there, that there's a divide in terms of people needing affordable housing. Look at the rest of our systems, our foster care systems, criminal justice systems, and other systems. People of color are overly represented in 100% of those systems. So what we're seeing is really a microcosm of these larger systems and the impact that it's having. The other conversation that I haven't heard as much talked about is really the implications of population health in San Antonio. Our population health outcomes have already been pretty horrible. And if you look at contemporary research, there's studies that show that social determinants of health are responsible for 80 to 90% of population health outcomes. And housing is the biggest one with that. So we're lacking housing. People aren't able to get into housing. And so our population health outcomes are going to get even worse and worse, which is going to be a huge financial burden. So again, it's sort of a call to action. We've got an opportunity, I think, right now to maybe finally bring in the Medicaid expansion in the state of Texas, now at a time where it's desperately needed. Why are we leaving millions of dollars on the table of the federal government? We really need to call to action to our governor to start accepting those funds so we can get children and the citizens of Texas healthcare that is desperately needed, especially today.
We're seeing the death toll from COVID-19 and how minorities are way overrepresented in that tally. This is also reflective of the housing crisis because we have a multi-generational housing, a lot of people sharing one house. We have one person have to go off to work because they're an essential worker, an hourly worker who's now essential, but they're not given the essentials of healthcare. They come back home and they bring it to, older people in the family, everyone else in the family, and then you have multiple people sick at once, and then it just goes bad from there. How How do we expect people to deal with this? Tuesday night, CEO of the San Antonio Growth on the Eastside stage. I mean, is this something that you have seen happening in your neighborhoods?
Oh my goodness. Yes, so much. And so in full transparency, I've attended a Zoom funeral for a cousin in New York. I have a Zoom funeral for a cousin tomorrow in DC. The disparity is real. And I hate the fact that people think that it initially was a virus that was only affecting people of color, because it wasn't. And obviously that's presenting itself more and more lately that it's not. But the issue is that the access to healthcare is completely different. I can go to a doctor that's my primary healthcare physician and maybe get a test and get it, who knows what, back in a day. There's people that are going to the Coliseum or going to other places where they're offering it for free, and they're getting it several days later. So you don't have a response. People are going back to work, they're going back to their families. And again, now that the children are home, there's multi people living in those homes. Everyone's kind of coexisting. It's spreading like wildfire. And the issue is that those essential workers that were our lower income, like you said, don't have access to healthcare and can't call their doctor. One of the most asinine things I heard initially during this apocalypse, is what I like to call it, is one of the commercials said, if you feel sick, call your primary physician and don't go to the hospital, stay home and get tested, and because you might not be able to get tested, or if you can, go. Who is low income, who may not have a primary care physician, can call their doctor and get that information or get access to a test. And so this is really just shining that spotlight, like I said, and it's really showing the economic instability of what's going on in our city. Thankfully, San Antonio has great partners and great people that we all work together in, and this is something that is going to take all of us working together to fix.
But many people who need to get tested for COVID are finding out that they can't get a free test, that they have to pay for out of their pocket. It's $150 in order to get that test. If you've already have lost your job, or you had your hours cut, or you're looking at maybe some people in your family that you need to help them out to keep them afloat, you don't have $150 to spare. So
Janie, I think you should just go with it.
Okay, David, we can't.
All right, so who wants to go on that?
Okay, so what I was going to say, David, is that at LiftFund, we've been around for 26 years, and over 80% of our portfolio in San Antonio is minority. Access to credit, access to financial literacy, access to technical assistance has been here for more than 26 years for the minority community. And it's going to continue to be there, right? Because of our education and everything else. So all of us collectively are doing our part to raise everybody up. And about the testing, here at LiftFund, we have a beautiful $8 million campus that was provided to us by our supporters. It's on the west side. It's in the poorest zip code in San Antonio, 78207. And sometimes right during these days, I think, and there's only 12 of us in here. What a shame. What a waste, right? Hopefully, but the good part is one of the buildings on our campus is a business incubator. Every year we incubate a different business. God blessed us this year. We are incubating a medical clinic, Central Texas Clinic. What are they doing? They are providing COVID testing. I'm getting tested every 2 weeks by walking 100 yards down there. My insurance is paying for it. They accept all insurances. They accept Medicare. And those that are uninsured, they have to have a social security number or a valid driver's license number. And it's free. Just fill out this form and you get your results in 2 days. I got tested Monday of this week. Wednesday, I got my results. So people don't know that. I keep telling people we're here. They take walk-ins. And so the point is that they are a small business that we're helping, and it happens to be a medical clinic, and it's wonderful, right? So hopefully people are listening, will come and get their tests.
So we had a cutout right there. So Janie, people can go to your location, and you're in Martin, is that right?
West Martin, 2007 West Martin Street. So if you just come down from Hope on West Martin, And you're going to get to the right, about a couple of miles down the road on West Martin. On the right-hand side is this beautiful oasis called LiftFund.
And you can see about getting tested there. I guess it would be better to call ahead to see.
Sure, or they take walk-ins, and you just sit outside in a beautiful little patio when it's not too hot.
All right, so now Tuesday night, you were a recipient of the COVID Response Fund. I guess other of y'all were as well. What did that funding allow you to do?
Well, it really helped us to get the equipment and continue to function. So we actually closed our doors March 17th, a little bit right when everything was happening, but we knew that it was coming. And so we were actually able to kind of get all of our technology together, kind of teach everyone and create the policies and procedures of what it was going to look like to work from home. The Area Foundation was amazing and came in and really did give us some financial assistance to help us get there, because we hadn't applied for the PPP yet. We hadn't gotten any of that additional funding. And so we are a nonprofit. We receive funding through grants, through galas that we talked about a little earlier, and through events. And so we know that that's going to look completely different. Some of our funding is state and federal. We know that those numbers have changed. Last time I heard, we're about $108 million short in the city budget. So we know that that might affect us, and it's going to affect a lot of nonprofits and small businesses in the city. So having organizations like Marjie's, having organizations like Janie's and Scott's really are important for us small businesses, because we can't exist if we can't get the funding, and we can't assist the businesses if we're not open. So we were just very fortunate in that we applied early, had the relationships, and can partner with people like on this call and in our city to be able to still continue to provide services. And again, by pivoting, that newsletter that we put out, Janie, we're going to put that information about your testing. It is the sharing of knowledge that we're trying to facilitate here, and by partnering with other businesses and organizations that can provide those services.
It's been so organic, David. It really has been, in terms of little bits go out. Like the Lavaca Association here, there's a newsletter that they put out where they themselves had gotten a PPP loan through us, and they were amazed that they could get it. And then they put it in the newsletter, and we got another 5 or 6. It's not a lot, but little by little, if we can spread the word by different, newsletters that this is available, we can, continue to help.
Marjie French at San Antonio Area Foundation, the COVID Response Fund, is that still available? Where are we with that?
It is still available. We are still seeking funding so that we can distribute funds out to the nonprofit community. We have the bandwidth to and the terrific staff here to be able to deploy resources. But at this time, we're open for donations for that COVID fund. I want to say that this last year we moved over into the arena of funding operating expenses for nonprofits. And so what you're hearing from Tuesdae is that we went ahead and trusted Tuesdae to know our own business, and we wanted to go ahead and fund operating expenses because we trust the nonprofit community. Some foundations are a little bit reluctant to go ahead and fund operating expenses, but we did it, and we were so glad we did, because we think it really made a difference in these last few months.
And I have an email from Rachel. According to the City of San Antonio Disability Access Office, disabilities are more highly prevalent among women, African Americans, Native Americans, Hispanic, and elderly population. People with disabilities survive on less than 60% of income of their peers. They're twice as likely to live in poverty as people without disabilities, yet this continues to be left out of conversations. As we look at vulnerable populations who are being hit hard by COVID-19, those who live with disabilities are certainly among those who really need special attention. So I'm wondering, Scott Ackerson at Prospera Housing Community Services, what we need to be doing to continue to include our population of folks with disabilities into these conversations.
So all of our properties are ADA accessible, and what's a little different about Prospera is we really cater our services to the people that live on the properties. So we've got several senior properties where the services are catered directly to them. So that's the good news. the bad news is across the United States, more and more people over the age of 55 will start experiencing homelessness for the first time, and we don't have the resources to be able to effectively impact them. And we've already got a huge number of people that are on fixed income. I did an analysis on what people on fixed income, be it SSI, SSDI, if they're paying market, they're paying 70–80% of their income for rent only. That's untenable. It can't continue like that. So, and then with the baby boomers aging, we really have to take a critical look at, do we have the housing capacity to provide for people that are getting up in years? And I think right now the answer is no.
And so Janie, is one of the largest micro lenders in the nation. You're providing access to capital for communities that have been historically marginalized. And this was a need that was already great before COVID. And these are people that really have no place else to turn to try to find capital that they can use to be entrepreneurs and people to grow businesses, create income and create jobs. So during this time, are we falling further behind? Is this ground that's not going to be able to be made back up? Are we looking at a lost year, or just, if we don't do this right, we could be looking at a lost decade? What are your concerns?
Well, I'm speaking to about the small business community here in San Antonio, and small businesses are pretty resilient. They're going to find a way to open up again. It may not be the same shop, it may not be the same way, but they're going to do it because in Spanish there's that word, tienen las ganas. They have the want and the need to want to do this. So the question really is how. And as Tuesdae pointed out, the Bexar County has made available about $15 million in either loans or grants that have all gone out. And when the information went out that these funds were available, we were oversubscribed, and by twofold, 2 to 1. And now the city has that the grant program too. $24 million, almost $25 million, $118 million in requests. So we know not everybody's going to survive in the way that they were before. So what we have to do at LiftFund is think about, okay, these are grants, right? So we've pivoted from the lending business to the grant making business in helping these small businesses survive. But what's going to happen after that? All these monies have to be put out by December 30th by the CARES Act. So what's going to happen January 1? What programs are we going to have in place there? At the Area Foundation, there's the African American Fund that, like donations that come into that fund, 100% of them are used in the African American community. And we are recipients of some of that fund, because what the San Antonio Area Foundation African American Fund Board does is allocates X amount of those dollars every year to come to LiftFund, so that we lend that money only to African American businesses here in San Antonio. And so that's another direct link that we have to the African American community, to be able to provide that access to capital. And it's money that is literally just for that community. We also have a fund just for the Latinos and Hispanics here in San Antonio. So there's different ways that we can make come up with a business plan, a game plan on how do we create not endowments, but they're funds that are just revolving in our community. A donation of $1 comes in, LiftFund lends it out in $1. The customer pays us back the $1, we re-lend it. So that's a sustainable way for all of us to be able to grow the economy here. And we're just going to have to figure out ways to make, the underwriting is going to be a little bit different moving forward than it has been in the past because of the crisis that we're in.
And we're seeing that philanthropy is much more than dollars right now. It's about community building and finding partners and look for force multipliers to deal with these challenges right now. And Marjie French at the San Antonio Area Foundation, how is that working for you? It's not just writing checks, and it's more than that in regards to helping during these times.
I think we're looking at asset building, right? especially in the communities of color and historically under-resourced communities. I will have to say that I do think I've seen so much innovation around public-private partnerships that it is encouraging. I think we're going to have to work harder and smarter to be able to overcome some of the challenges that we have right now. But if you look at the Family Independence Initiative that used this marvelous network to grant monies into families that needed the money, I thought that was some spectacular work that was done. I know we had invested in that early, and I thought it continued to pay off during COVID. We an initiative called Get Shift Done, which was a collaboration with the United Way. I thought that was a marvelous way for the public and private sector to get together, and where we helped restaurant workers who had lost their jobs. Get Shift Done actually pays them to volunteer at the food bank. So that's just another example of I believe how innovation and public-private partnerships are really working, and will hopefully help us get over the hump.
Well, Tuesday night, unfortunately, no matter what we do, there's going to be losses in this crisis. That's why it's a tragedy. How are we going to help people? I mean, a family's been working on a small business their entire life, and then it gets wiped out for no fault of their own. We may probably have another lockdown, who knows, because this COVID thing's not going to go away on its own. That's going to really knock out people. How do we help people get going again? I mean, first of all, spiritually as well as economically.
That's a loaded question.
But we have to think about, their minds, it's really hard. It's hard for people.
It is. And you think about it with these small businesses, it is what they have and it is who they are. And so it is tied to so many things. It's tied to your family. It's tied to your financial future. It's tied to your children's future. It's tied to education. It's tied to healthcare. It's tied to everything. So when the CARES Act came out in the second quarter, it was good. It was a good influx of money and funding into the community. But unfortunately, it's not a never-ending pot of money. And so it came in and it helped, but it didn't help everybody initially. There were a lot of businesses that didn't apply. There were a lot of businesses that didn't quite understand what it was or what they would have to repay it or what that looked like. So a lot of people didn't even apply in that first round. So then comes second and third round, and now they're starting to. But now it's starting to be too late. Many of these businesses who rely on patrons walking in the door, patrons just driving by and seeing who they are, or better yet, going out to have lunch and stopping at a familiar restaurant that they know in the community. So those businesses shuttered. Some of them are not going to be able to reopen. Some of them are not going to be able to reemploy the people that they had to let go or furlough. But thankfully, as Janie mentioned, these businesses are resilient and they are trying to come back. But my concern is that they're not going to be able to reopen in the same manner. So what that means is going forward, we need to offer some education. I know the city of San Antonio is working on providing resources for workforce and education development. I know that there's lots of other entities that are trying to do that, but we have to teach people how to fish. Giving them the fish at this time is great and it's necessary, but we need for them to be able to sustain themselves after all of this is over. And who knows if there's going to be any more funding available? There may not be. So we have to figure out what is working for them now and what can get them to sustain themselves in the future. Because as Janie mentioned, who knows what's going to happen in January? We don't know. And what's going to be open is going to be more of the essential workers having to go and put themselves out on the front line, whether they want to or not.
Scott Ackerson at Prospera Housing Community Services, and community is the word that I want to stress there. What's happening at your facilities where you're helping people realize that they're not alone?
So one of the things that really fascinated me when I started working at Prospera, I was a single dad for 10 years and lived in apartments. And more often than not, I didn't even know my next door neighbor, didn't know their name, probably didn't even know what they looked like. I think our sense of community across the United States has really gone away. What's different about Prospera, it really is a community. Neighbors taking care of neighbors, helping with childcare, all those things that we used to see, which really helps people survive these types of tragic events. So it's really community supporting each other, and a part of that community is Prospera through the supportive services. So it's really an equation that works very well.
And we have a question from Jane. If you're a small business owner and has not filed your 2019 taxes, do you still qualify for PPP funds? Let's go to Janie Barrera for that.
If you've not, I hope you've gotten an extension. Because the deadline was July 15th. So that would be first thing, go get an extension. The second answer would be, the second part of the answer is that you will use the information to apply. Yes, you can apply. You will need to use the information that you would have used if you had not gotten an extension as your information. So the other part of the answer is too, that if you did not do an extension, that means you're delinquent on your taxes right now, and we cannot help you. So if you did not file for an extension, we cannot help. If you did file an extension, we can.
But so people may have had like a bonus 2019 year. I mean, just like, it was a great year for me. I made all this money. Now I got to pay my taxes. Unfortunately, I've already exhausted everything that I have to stay afloat. And now I'm kind of snookered. What do I do, Janie?
It's better. If you had a great 2019, that's even better, because what you're doing is you're using your 2019 numbers. You're going to that Schedule C, line 31. That number, if it was a great number, divided by 12, multiplied by 2.5. That's what you're going to get for helping you with the payroll now, going forward for the next 24 weeks. And it used to be the PPP was, now it's 60% of, let's just say you get $10,000 in a PPP loan that turns into a grant, 6,000 must be used for payroll, utilities, or rent, and income, I should say. Interest, it may be that you have that's existing, and then 40% can be used for anything else. So once you reach that 60% within maybe by week 8 or 9, that's it. You've qualified. Start putting your paperwork to get it forgiven.
Ask for help. Find someone like Janie Barrera. Let them know. If you don't be in denial. This is something that's not going to go away on its.
No, people have said to me, no, I can't qualify. Come on, let me show you. Right, Tuesdae?
Yeah. Absolutely. We helped so many people. And back to even that issue, when you talk about all of the information that's needed to apply for some of these things, one, it's digitally, right? So it's online, but also a lot of people didn't have access to their accountants or to people who were doing their taxes for them. And so having to come together and pull all of that information to apply for some of this was really difficult initially. So yes, Janie mentioned that the extension needs to be filed, but hopefully there'll be some more funding opportunities that will allow people to do that. But it really was something that just came, and people needed that information, and some of them just didn't have access to it.
So in the last couple of minutes we have left, I want to turn to Marjie French, CEO of the San Antonio Area Foundation, and ask you about tapping into San Antonio's greatest strength, which is our community, and encouraging people to turn towards each other and find these solutions, not just find dollars to help keep the roofs over the head. That's important, but also the nourishment from a psychological point of view. You're not in this alone. We're in this together. I mean, how are we communicating that?
That's a good question. First of all, I want to say that one of the areas that we have fun, and many of our collaborators, the other foundations in town, are focusing on mental health right now. So I want everyone to know that mental health is so important. I know that even CEOs and foundation leaders and government officials are all, I think, feeling a little disconnected right now. And so I think it's important for us to reach out and communicate more. the Area Foundation is going to continue to do its work. We're going to continue to build up our community. Hopefully, we'll build it to we'll build even stronger. Everybody has opportunities to succeed in our community, and but I do think it's important for us to continue to do the good work, to collaborate with each other. Finally, I'll have to say that our partners during this time have been incredible. Our partnership with United Way, with the other foundations in town, the corporations, with the city, have just gotten stronger. And so I really want to say that it's not all bad news, that if we can continue to work together and communicate together, I know we'll succeed.
All right, I want to thank all of our panelists as we wrap up here. That was Marjie French, the CEO of the San Antonio Area Foundation. Also joining us Tuesday night, CEO of San Antonio Growth on the Eastside, SAGE, Janie Barrera, President and CEO of LiftFund, and Scott Ackerson, Executive Vice President of Strategic Relationships and Services for Prospera Housing Community Services. Thank you for joining us today for our first 4 community conversations centered on the San Antonio Area Foundation's 4 impact areas: livable and resilient communities, youth success, successful aging, and cultural vibrancy. Join us on September 17th and 18th when we address how to ensure youth success in the middle of the pandemic, a very vital conversation. And these vital conversations are made possible by the John L. Santikos Charitable Foundation, a fund of the San Antonio Area Foundation. I'm David Martin Davies from Texas Public Radio's The Source. Thanks for joining us.